Hello everyone. Today we will be discussing on anxiety, anxiety disorder. So this is one of the health condition which is predominantly affecting nowadays in every age group of people. It is not only confined to the elder people, the cases and the patients or individuals, those who are in uh, less age group. They are also having in some other way they are expressing or they are complaining, they are showing the symptoms of anxiety related health issues. Now let's understand what is this anxiety and anxiety related problems. So it is in the simplest language, simplest words to understand. Anxiety, it represents that excessive worry about everyday issues. Any type of issue, either it is family issue, either it is social issue, it is work related, health related issues, any of the issues for which any age group of the people, if they are having excessive worry, that we can term it as anxiety. Moreover, when this anxiety, it gives them effect which is directly hampering their other activities, or it is giving some discomfort to their normal routine activities, which probably the individual or the patient who is suffering, he may not able to understand, he may not able to differentiate, but that assessment, that difference of that activity or difference of that the response of his body compared to the normal healthy person, that can be assessed, that can be observed by either by family members, either on any of the health conditions if they are being consulted with, or if that is been diagnosed or analyzed or assessed by doctor. So those type of things wherein we get some means uneasiness, or which is hampering their normal routine work, if those type of things are there, where that need to be addressed. Because anxiety disorder, it is not only, in long run, it is not only confined only to the individual as such. It will be giving the ill effect or the bad effect of this problem on the individual's approach towards life, how he accepts or handles the situation, how they takes that situations that comes in front of them, and how they handle that, either it is work related, their social life related, their family related. So all these things need to be addressed very cautiously, and it should not be ignored. Let's understand why it is so, why this anxiety should not be ignored or it should not be overlooked. The main reason what it can lead is, it can lead to irritation, irritability in the behavior, agitation, maybe due to some organic condition, maybe due to some environmental condition, maybe due to some bad habits or addictions. Whatever the cause is, in the somewhere or the other way, it will be aggravating the individual's response and their behavior towards, not only towards themselves, towards the other members of the family, towards the people in the society, towards the people in their workplace, and so that way it becomes highly advisable that these type of problems should not be ignored, should not be taken lightly. Now, what are the various causes? When we talk about broadly, when we classify this anxiety, that can be uh, predominantly that can be taken on the case when the organic factors or that mental conditions, when these type of reasons are there for that anxiety, when these are the causes, those conditions or that particular stage of the anxiety or the problematic stage must be given medical attention. When the problem which is related to the mental issues, when it is an organic cause of that, so these type of things should be given the medical attention. Medical care, medical treatment should be taken properly on that. The second cause or second type of this is which due to unfavorable condition, temperament. So in this case, it is advisable that care and necessary treatment should be taken, which is which can be managed, which can be easily performed at the individual or the family and the home itself. That is the dispersive measures, whichever is that the temperament or that environmental unfavorable condition which is causing, we have to disperse it, keep it away. In addition to that, we can plan foot and arm foot and arm bath. When we soak our foot in water, in hot water, when we soak our arm in hot water, that will be very helpful in reducing these type of anxiety causes. So we need to understand what exactly is the cause. Merely understanding that anxiety, relating with the symptoms, going with the social media information and little information from any of these books or medical resources, that will not give you the sufficient, or then that will not give you the complete solution. So once we got our problem diagnosed properly, assessed properly by the medical specialist, senior experienced doctors, based on that, we need to differentiate the cause of it. The cause should be taken care at the priority. If we hit the cause with the right attention, we can expect that the result, what the change we should expect, we will be getting it. The third cause, what we can understand and what we have to keep in mind or we have to observe is any type of addiction or bad habits. Mistakes, whichever is been inculcated by some bad habits or some addictions, these type of practices, if something has been developed inside the body in that mindset, that need to be corrected by changing the place, by avoiding those bad practices or addiction habits. So in this way, we just try to understand the based on the cause of the anxiety, whether it is organic or it is mental condition related. Number two, whether it is temperament or it is unfavorable condition generated. The third, whether it is due to some bad practices or some addictions. So based on these causes of the anxiety, if we take these measures, that will be highly effective for the individual. The problem what is, which we normally get mistreated or we get mishandled, is because what we have seen and what I feel normally, that people are getting very hard to come out of this type of problems is they just go with that broad spectrum treatment. Like broadly, when we talk about anxiety, they just go with this is anxiety, these type of things are required, these type of things, care and medicine and all these things are required. So what will happen, the patient or individual or family or that treating doctor, they are compelled to follow a designated path for the treatment, follow that specified path for the treatment. Then later, in due course of time, what happens? That becomes the practice, that becomes the habit. Any deviation in any form of medication, that also is disastrous. The patient will not be, psychologically, patient will not accept it because of that turmoils and the sufferings and the change or the swing in the mood, what he normally feels when he gets that anxiety or the panic disorders. So in this case, it is highly important, if you want to get rid of the problem, let's make it very clear. Let's try and understand the cause of the problem, because every disease is not there to stay in your body. Neither it is generated by you, nor it is blessed by nature. That none of the disease is meant, or is, it gets in the system to stay there permanently. Only we need to understand the correct, effective, and scientific approach. It is not merely collecting some information and treating the problem will suffice the purpose. Somewhere or the other, you will be having some or the other, like, misinterpretation, or rather you can say that the problem will mislead you, the treatment will not be complete. So that creates a feeler that anxiety disorder is there, or depression is there, or any type of mental health issues are there. These issues are permanent with the patient. So I am just trying here to make it clear, make people understand the beauty. And if they follow the correct path, if they follow that scientific approach, methodological approach, there are better chances for their not only recovery, for reversal of the problem also. Now let's understand what are the diseases that normally we consider when we talk about anxiety related problems. Various problems it comes under this: schizophrenia, hallucination, bipolar disorder. So these are the various diseases based on the symptoms that a expert, experienced doctor can only, after assessing your symptoms, after analyzing your symptoms, they can diagnose, and they can pinpoint the symptoms, pinpoint the exact problem. Based on that analysis, the treatment is required. So that becomes effective treatment. When we talk about getting a reversal or getting that completely cure from the disorder, this type of mental health related problems, so for that it is highly important that your assessment should be at very minute level, very microscopic level, and it should be done with a clear intention, not only at the treating, at the doctor end, it should be very clear at the patient and families, and that what is the problem, and the patient should be willing to come out of the. When you have problem, that particular moment, if you feel I want to come out of this problem, will not suffice. It's an internal pull. Internally you have to pull yourself, or you have to push yourself in a way to genuinely, you have to come out of the problem. Superficially, if you approach, superficially if you behave, if you take the treatment, that will not give you the results. Again, it will get converted into the chronic stages of the problems. Every problem which we discussed related to the mental health, gradually it gets converted into the chronic form. The intensity and the severity and the symptoms that the patient expresses, that gets aggravated, and that retains, that expresses for long duration in the daytime. So in order to have a better result, in order to have a better recovery from these problems, it is highly important the patient, their attendants, their family members should work in tandem with the medical fraternity, doctors, specialists, and they should be completely in coordination, completely in sync with the treatment methods to recover from. Because psychologically, emotionally, from your inner feeling, you have to expel the disease. You have to expel the disorder. You have to change that diseased mindset. If you are ready, if you are willing, if you follow that practice to come out of the diseased mindset, result is inevitable. Now, let's understand what are the reasons for anxiety disorder or any type of mental health related issues. Number one is genetic factor. Number two, very important, dysfunctional families. This plays very important role in the family. If the family environment, atmosphere in the family is not congenial, not healthy, that will lead to some or the other mental health related problems. Third point, what we can understand, then the third reason is situational reasons. Situations, various situation it comes in individual's life, that also can be the reason for anxiety or mental health related issues created. And the fourth reason is drugs or few medications that the patient has been using or used or using for some or the other treatment of a health problem. That also can be the reason. So drugs and medications also, they are the reason for anxiety disorder. So these are the various reasons. Simplest way, we are just trying to understand the reasons. Now we will try and understand what are the symptoms the patient will express. Initially, the symptoms will be mild. The patient may express mild symptom. He'll be expressing few symptoms, mild symptom, very short duration symptoms. But when the situation gets aggravated and if not treated properly, mistreated conditions were there, the symptoms will be expressed prominently. It will be expressed for longer duration in the day. And the patient's behavior, irritability, agitation, aggressiveness, and so many other conditions, symptoms the patient express, that will be highly, it will be overtly expressing. So let's understand the symptoms. The number one symptom what the patient, these type of patient they express is sleep disturbance. They will be having disturbed sleep. Number two symptom is they'll be finding difficulty in concentrating. Any work they do, they'll be not able to concentrate there. Either it is study, either it is some work, either they are going for some function or somewhere, they'll not be able to concentrate. The third is various physical symptoms what the patient will complain, like headache, sweating, the patient will sweat, increase in urine output, number of times he goes for urine, passing urine is more, restlessness, patient will be discomfort, uneasiness feeling will be there, and unwarranted, unexpected fatigue will be there. So these are the physical complaints what the normally the patient they feel or they express. We discussed just now, in the initial stage of this anxiety or the mental health related condition, patient will be having milder symptoms, mildly symptoms expression will be there. In the chronic stage, and when the condition is getting deteriorated slowly, the symptoms will be for longer duration. The intensity of the problem, headache and other things will be more. Two or three symptoms may club together and express. So these are the various stages and expression of symptoms by the body. And the last is panic attack. Panic attack is suddenly, all of a sudden, the patient will get panicked, either due to some situation, some circumstances, or due to uh, some event. And in the panic attack, what the symptom will patient he will express heart palpitation. He will feel the sound. He will feel that heart is pumping. Normally, the people will not feel, but in those people, those who have heart palpitation, they will feel that dhak sound. They will feel it will be audible, and they will be more discomfort with that. Short breath, and in few cases, nausea sensation, vomiting sensation also will be there. So these are the various symptoms which body express, particularly when the patient is suffering from anxiety disorder or any type of mental health related issues. Now, what are the harmful effects? What are the bad effects or long-term repercussions if these type of anxiety disorders or mental health related problems or depressive conditions are not treated properly? Number one, it will lead to aggression in behavior, irritability, agitation. The patient, second point is patient will be nervous. Nervousness will be more. Third, in few patient, weight gain will be there. Fourth, digestion related problem. Digestion, it will be upset. In few patients, they complain constipation. And in few patients, they complain like diarrhea-like symptoms. Irregular bowel movement will be there. And fourth point is low sex drive or impotency in males. That again, the reason for this is anxiety, stress. And the last and very important point is these type of patient in due course of time, they develop suicidal thoughts. They will develop, they will look for, they will plan, they will start thinking about, and in few cases, they take steps also, they commit suicide. So these are the very important ill effects or that long-term repercussions if anxiety disorder and this chronic mental health issues are not treated properly. Now let's understand what are the methods that we can do from the naturopathic and natural means, which is not only effective in bringing that patient back from the disease, but it will be highly effective if these type of practices or methods are being followed under the guidance of experienced doctor. This will be very helpful in revival or that reversal of these anxiety disorders. There are many other points as well, but just we have tried, I'll be giving you the few key points that will be highly beneficial for the people or the family members or the society people, those who are suffering from this. So the number one method what we can follow is farewell to fear. Come out of this fear, come out of the fear of the suffering. That is number one. डर को भगाओ, डर नहीं रखना है. बीमारी कुछ भी ऐसी नहीं जो ठीक नहीं हो सकती. We have to make up our mind that I want to come out of it. Number two, proper examination, analysis, assessment of your health condition. No superficial counseling. It should be elaborate, it should be an experienced doctor who will be assessing, analyzing, and counseling your symptoms for a better cure. So that assessment is very much required. That's why we can differentiate what is the cause for your anxiety. because nature says we need to understand why you have this problem. What is the cause of your problem? Because disease is not blessed or not given from nature. It is we have converted it. So we need to understand what is the cause of it. For that, proper analysis and counseling of your health condition and mental symptoms and your anxiety problem is must. Third point is brain detox, brain and thought detox. Whatever thoughts, whatever you have in your mind, in your brain, that is giving you uneasiness or discomfort, that need to be detoxed. Fourth point, fourth method, what we can follow is defocus. Defocus the problematic thought, defocus the situation, remove your focus from that which is giving you problem or discomfort or uneasiness. Speak up. You need to speak to your, you need to share your problem, you need to discuss your problem with someone who is caring for you, your family, your friend, your doctor. So speak up your problem. घुटना घुटन नहीं होना है, घुटन करने से बीमारी बढ़ती है. So we need to share, we need to express our problem. Fifth point is positive attitude. It's very important. Do you really want? Why you want? That should be positively defined by you only, which is very much possible. Sixth point is breathing exercise. Yoga and breathing exercise. You can expect exponential change, positive change in your body, in your anxiety or mental health condition, complete in itself. It will be very supportive for your health, mental health problems. Very simple and very important. Next method is laugh a lot. खूब हंसो. If you laugh, laughing is the best medicine. Be the part of the occasion where you can laugh. Be with friends, be with family, be with your known and office colleagues where you can laugh. If you laugh, your stress gets burst. When you laugh a lot, then calm down. So these methods are holistic rejuvenator for your mental health condition, for your anxiety disorder, provided it is taken after proper analysis of your mental health condition, your body requirement, and your cause of your problem. These methods, if followed under the guidance of experienced professionals, experienced doctors, there is no second thought that your problem can not only be treated well, it can be gradually reversed also. So with this, I hope the information and the gravity of this anxiety disorder, we have tried to make it as simple as possible for common public to understand and relate their any type of health related, mental health related problems in order to not only get result, to get a proper care and proper management, but a proper focus on methods also laid and more also discussed how we can lay out the treatment plan, how we can strategize our treatment individually in order to get it reversed, in order to get the health back from the long suffering they have been undergoing from the anxiety disorder or any type of mental health related problems. So if you have any type of problems, feel free to connect with me. If you want to discuss with any of your health related issues with mental problem or any type of health issues, you are most welcome to discuss or comment on the my social media platforms, or you can connect with my numbers also. Looking forward to see you happy, healthy, and anxiety free future for your family and for your loved ones. Thank you very much. Take care for yourself.